The Midlands Hearing Implant Programme is a highly specialist regional service meeting the needs of patients with more complex hearing problems requiring a surgical solution. The Cochlear Implant Programme was established in 1990, and between the adult and paediatric services we have performed over 1,000 implants for patients from all across our region. Our programme has expanded and developed, and we are now able to offer a range of implantable hearing technologies for a wide range of hearing problems. We are a multidisciplinary team and are one of the largest implant programmes in the country. This video will show you the patient journey. We will meet some people who have had a cochlear implant, and you will hear about their experiences. You will find out about cochlear implants and how they work. You will also learn more about the assessment process and the operation, plus any associated risks. We will find out how cochlear implants can change people's lives.
I lost my hearing when I was 35. Over 5 years I went from having totally normal hearing to becoming profoundly deaf. It was a huge impact on my life. Everything that I did. At the time I was working at the bank in a call centre environment, and obviously couldn't use the telephone at all, couldn't go into meetings. Found it very, very difficult to come to terms that I could no longer do the job that I loved and I'd done for 20 years. Also during that time that I lost my hearing, I had a baby that I couldn't hear cry, that I couldn't hear gurgle or when he started to talk. For my family, it was as devastating for them as it was for me.
Resorted to not only hearing aids, but a phonic microphone, which I needed if I was in conversation with people in a family room, to pass around to each individual person so that I could take part in whatever was going on.
All my friends who I had, because I was quite sociable, a number of them, sadly, because of my hearing loss, were embarrassed that I couldn't hear them and would have to write notes down. So I saw less and less of my friends at the time.
When I was 17, I ended up moving to London, living to London by myself. That's when I learnt how really deaf I was and how much I did rely on my parents very much. I struggled quite hard with that. I found work extremely hard. I was working as a hairdresser in a salon. Found that all extremely hard. My hearing was deteriorating little by little at a time.
The British Cochlear Implant Group is the professional organisation that represents all the implant centres in the UK. The BCIG sets out the quality standards that all teams adhere to in order to ensure that a high quality of care is maintained throughout the country. There are only about 20 specialist implant centres in the UK, and this ensures that teams build up the necessary expertise essential for good outcomes. Whilst this means that you may have a long journey to your nearest implant centre, it means you will be seen by highly experienced clinicians working in specialist, multidisciplinary teams.
A cochlear implant may be recommended for someone who has severe to profound permanent deafness in both ears, but has either had better hearing in the past or has always used the hearing that they have left through conventional hearing aids. The CI system has two parts. The internal electrode array is inserted into the organ of hearing, the cochlea, by a specialist ear, nose and throat consultant. The electrodes are placed so that they stimulate the hearing nerve endings. The internal components of the cochlear implant cannot work without the external parts, which are fitted approximately 4 weeks after the operation. The external components consist of several parts, including a microphone which picks up sound in the environment. These sounds are then encoded by the speech processor, which looks like a large hearing aid, but in fact is more like a specialised computer. The encoded signals are passed across the skin via a magnetic connection to the internal components. This magnetic connection is made via the coil or headpiece, which is a small round device on the side of the head. It transmits the encoded signals to the internal device via radio waves and is held in place over the internal electronics by a magnet. The signals are then decoded and the internal electrodes are activated in a particular sequence in order to produce a sensation of sound.
If you remember. So just watch his face, repeat back to me what he says, word for word if you can.
The initial assessment takes place in a hearing implant clinic. You will have a test of your hearing and also a test listening to sentences with your hearing aids. You will then meet your ENT consultant and members of the hearing implant team. We will discuss your hearing history and give you an opportunity to ask questions about implants. At the end of this appointment, it will be decided whether or not you will go on to the next stage of assessment. The assessment may involve the following: assessment of your current hearing aids, lip reading tests, speech perception testing, communication evaluation, an explanation of Cochlear and other implants and how they work, expectations counselling, an opportunity to meet an implant user, device counselling, and auditory brainstem response, or ABR.
As part of the assessment, it's likely that we'll want to do some scans of the inner ears. There are two types of scan. One is a CT scan, which is an X-ray scan of the bones of the inner ear and cochlea. This can help us decide some of the surgical approach and some of the structure of the cochlea itself. The other scan is an MRI scan, and that will look at the nerve of hearing as it moves from the ear into the brain, and that can provide useful information on your hearing pathway.
The whole process of the assessment things was quite interesting, actually. The actual test was quite scary, but not scary at the same time. Like one of the machines you had to go in was a big round thing. They told me to put things inside my ears. I said, what's the point? I ain't going to hear it. They're saying it was really, really, really loud. I'm thinking, why am I putting me in? I'm deaf. I ain't going to hear it. But it was extremely loud and the vibrations of it was very loud. But I think I might have heard it, but I'm not sure if I did hear it. But there was other assessments that you had to have, like electrodes on your heads to test your balance and things like that.
And then I had various scans where you go into a tunnel, and to be honest, you do feel a little bit claustrophobic. But the fact that you can't hear, and once you shut your eyes, you could be anywhere. I didn't find it difficult at all.
Subtitles on. The lady also said she couldn't go to the theatre or the cinema because she couldn't.
You will then be invited back to an implant decision clinic to meet the ENT consultant and the team again. We will let you know the results of our assessments and whether or not we recommend an implant. If an implant is appropriate for you, a date for your surgery will be arranged, pending agreement of funding from the appropriate funding body. When a surgery date has been arranged, you will be asked to return to the clinic to collect your sound processor, so that you can become familiar with your device prior to your switch on. All pre-admission tests will be done at this appointment, including your vaccination against meningitis.
The operation is performed under a general anaesthetic and normally takes about 2 hours. First, a small area of hair is shaved from behind the ear, and then a hollow is created in the bone behind the ear and under the skin. The electronics and the magnet are fixed here, and it is the route to the inner ear, so that we can insert the electrode array into the cochlear. The electrodes are placed so that they stimulate the hearing nerve endings. Once all the components are in place, the area is stitched and a dressing is applied. Most people have their surgery performed as a day case or only spend 1 night in hospital after surgery, and many can return to work after a short period of recovery. Some patients report a little dizziness following surgery, but this usually subsides after a short while. Afterwards, all that is visible on the outside is a scar behind the ear. You will be able to feel a slight bump under the skin. This is the internal electronics and the magnet of the implant.
Before surgery, the risks and benefits of the procedure will be clearly explained to you. No surgery is completely without risk, but please be aware that although problems can occur, they are very rare. Great care is taken in the operating theatre to minimise the likelihood of these problems occurring. The risks of cochlear implant surgery include infection, bleeding, damage to the facial nerve leading to temporary or permanent facial weakness on one side, damage to the chorda tympani, the nerve that supplies taste to one side of the tongue. Damage to this nerve causes temporary or permanent disruption to taste. Meningitis, a vaccine is given preoperatively against this. Balance disturbance, this is usually temporary but can, in rare cases, be permanent. Tinnitus may be triggered or, when already present, exacerbated. This is typically resolved after the device is activated. Device failure. If at this point you wish to continue with the cochlear implant procedure, we will ask you to sign a consent form.
Everybody is very, very nice, very calm and reassuring, and they put you off to sleep and do what they have to do. It was about 3 hours. They came back onto the ward, and within 2 hours I was out of bed. I felt a bit groggy. You have a bandage on your head. I had no headaches. I didn't feel sick. I just felt as though I'd had a nice sleep. No pain whatsoever.
My stay in hospital, I cannot fault. And the people that looked after me, I cannot fault those otherwise. And my recovery, according to David Poops and Louise and even Patrick, I only stayed in hospital 2 nights. I went in on the Monday and I came out on the Wednesday.
Came round, no problem. Didn't have any effects whatsoever. And the next day I was up and about as if nothing had happened.
On the actual day of the operation, they keep asking the same questions over and over again, make sure they're doing it in the right ear and things like that. I was quite nervous a few days before, but on the actual day, I just wanted to get in there and get it done. The operation itself, well, I woke up, didn't even realise I had it done, to be honest with you, because I'm a hairdresser. I was worried about how much hair they're going to shave off. But no, you couldn't even tell that I had, some of my hair shaven off, which I was quite pleased about.
Before you went home, you had an X-ray. Yeah. Do you want to have a look at it?
You will not be able to hear with the implant until it is activated. This is called the switch on and takes place approximately 4 weeks later. Any hearing you may have had this side of the head may be lost and you may not be able to hear to wear your hearing aid.
I'm going to play some sounds through the implant.
Okay. Two beeps. It's getting a little bit louder.
Good. We'll switch over to live speech so you can hear my voice. Right, that's on then. So that's obviously switched on because it made you jump.
Yeah.
Are you picking up my voice now? And what sort of loudness is that?
That's too loud.
Okay. The good news is I'm not having to write anything down.
Any hearing you may have had on this side of the head may be lost and you may not be able to wear your hearing aid. If you are a hearing aid user, you can continue to use your hearing aid on the non-implanted ear. Some people find this a difficult period, especially if they have received the implant in their good ear. Interim appointments with the hearing therapist can be arranged prior to switch on if extra support is needed during this time.
The sounds generated by the implant are electrical in origin. The implant may sound electronic and unnatural to you at first. During the switch-on period, some people find it hard to understand what they're hearing, and distinguishing one sound from the other can be difficult. However, with support from the implant team, patients learn to make sense of the signals, and gradually, over time, the sounds become more pleasant, natural, and meaningful. The vast majority of our patients report benefit from their implants, although the amount of benefit varies from person to person and depends on a variety of factors. Most people are able to hear a wide range of environmental sounds. Many understand familiar phrases without lip reading, and some patients find they're able to use the telephone again.
It fits the implant onto my ear to correspond with what's inside, puts it round my ear, I sit down, and I lip read her say, I'm going to switch it on. And I hear beep, beep, and I look and started to cry, and then the family start to cry, and for the first time in 12 years I could hear, initially everybody sounds a bit like Mickey Mouse. They're Welsh Mickey Mouse or a Liverpool Mickey Mouse. Squeaky, not as you've ever heard a sound before.
And went to Sally Hope, my eldest son took me. And when it was switched on, the first voice I heard was his, and it sounded perfectly normal, just the same tones, and it was wonderful.
Close my eyes for a few seconds. Will I be able to hear my granddaughter speak for the first time? She's 5 or 6. I'd never heard her talk. Will I hear the birds sing? I think so. Okay. Do it, girl. And she did. And she said to me, can you hear me? I'm doing the same thing. I'm reliving it. Look. I said, yes.
When I eventually got switched on, there was 3 people in the room. There was my mum, the hearing therapist, and one of the technicians. And I kept thinking, oh, don't talk to me all at once because it's loud. But it was a lovely feeling, and I kept thinking, I've never heard this much in my life. So it was exciting at the same time.
And when it switched on, I didn't know what to expect, but feedback from before saying that it sounded like Mickey Mousey sort of noise, which was kind of what I was expecting, like imitation of Mickey Mouse in my head, but it was nothing like that. For me, my experience, it sounded like I was inside a pinball machine. It's all you could, it's all you could hear.
And a month later, I had to come back and see Stuart Burrell, who was going to switch the implant on for me. I had, of course, been to the hospital to have the packing and the stitches and that out in the meantime. And when it was connected to the computer and switched on, I could hear the beeps, which are the test beeps that they put through. But then when Stuart switched it to the microphone and started to talk to me, I just devastated I was. I couldn't believe it. His voice sounded like one of these cartoon characters, but speaking underwater. And I just couldn't make out what he was saying. At home, later that evening, I decided that I would put it on again, the implant. And I sat there, and I could hear this noise. I was looking towards my kitchen, and I could hear my washing machine going through the spin cycle, and I hadn't heard that at all since I'd been deaf. And within 3 days, because I went back to the hospital, for some reason it suddenly just clicked, and I could understand what Stuart was saying to me.
Since the operation, it's totally different. Last week, I've started in a beauty salon. Within a week, I've managed to secure 10 new clients. And that is because I can talk to them and I can hear them. Everybody sounds normal. Or everybody sounds how it used to sound. No Mickey Mouse. It's perfect. I can use the telephone. I can hear music.
I know exactly what I'm doing with my life and where I am going. Thanks to the Cochlear. This is, I cannot explain, every single morning of my life when I put this in my ear or on top of my head, I become alive.
I mean, I won't change for the world. I've enjoyed everything that I've been through. It's made me the person that I am today, and I'm a lot stronger as a person I am today. It changed my life, completely changed my life. I've gone back to college, which things I would never, ever dreamed of doing. As soon as I got the first implant, that was it. I was off. I wanted to experiment. I wanted to do things. I wanted to do something with my life.
Now that I've had 2 implants, like I said, I'm still learning every day with the music, learning every day with the language. But one thing that has changed is the social impact. I go out line dancing twice a week. I go out down to the club. I go out dancing every Saturday. I mingle with everybody, and I mingle with them even though I've never heard them speak before.
So I rely on this implant totally. And even when I've been given additional support, such as lip reading or lip speaking or signing, I still fall back on using my implant. Without it, I just wouldn't have the sort of quality of life that I have now.
We accept referrals for patients who are 16 years of age and older. There is no upper age limit to having a cochlear implant, as long as you are medically fit for surgery. Our patients have severe to profound sensorineural hearing losses and only receive limited benefit from conventional hearing aids. In addition, we look to see if potential patients can show evidence of oral communication, even if signing skills are also used. Our referrals usually come from ear, nose and throat consultants, general practitioners, audiologists, hearing therapists and other hearing professionals.